morning, everyone. Delighted that you were able to join us today. My name is Joan Batorf. I'm here at the University of British Columbia's Okanagan campus in Kelowna. And I want to begin by acknowledging that at UBC Okanagan, we're situated on the traditional and ancestral territory of the Syilx Okanagan Nation. I also want to acknowledge that many of you might be joining us today from other places, both near and far, and I want to take time to acknowledge the traditional owners and caretakers of those lands as well. I am a professor here at UBC Okanagan and director of the Institute for Healthy Living and Chronic Disease Prevention. And we're especially delighted to welcome you to today's webinar. And before I introduce our speakers, I just want to let you know that we have a live transcript closed captioning enabled, and you can move that box to anywhere on your screen. And you can also turn it off if you find it distracting or not very helpful by clicking on the live transcript button and turning it off. I do want to I've got phones ringing. I do want to let you know that we will have time for questions and comments at the end. And I welcome you to put them in the chat box, and we will direct them to our speakers. So before I begin, I want to just remind you that we're almost at the end of October, if you can believe it. And next month is November, or as many of us recognize it now as Movember. And this is a very popular month, and it's gained a lot of popularity over the years. And Movember has been a worldwide initiative to draw attention to men's health in particular, and to men who've been diagnosed with cancer as one of the groups that Movember focuses on. There's a whole raft of activities that the Movember people have organized every year and will do again this year. And one of their biggest issues is in the area of prostate cancer. One of their goals is to support the sharing of research to accelerate progress in the way that we can treat and support men and promote their health. And so it's really great timing to have our two speakers here today to talk about exercise and why this matters to men after a cancer diagnosis. So I'm really pleased to introduce Kristin Campbell, who is at the Department of Physical Therapy at UBC Vancouver, and Sarah Neil-Sztramko, who is at the Department of Health Research Methods, Evidence and Impact at McMaster University. So welcome, Kristin and Sarah. I'm going to turn it over to you.
Great, thank you, Joan. So Kristin is going to share slides, so we'll pull those up, and I'm going to start us off this morning. Great, thank you. Okay, so exercise, why does this matter to men after a prostate cancer diagnosis? Go to the next slide. Perfect. So just to give a little bit of an outline of where we're going this morning, I'll first start with outlining a little bit of the research on the role that exercise has in improving overall health and the side effects of cancer treatment, including a discussion about the potential of exercise to reduce your risk of cancer returning after a preliminary diagnosis. Then we'll shift focus a little bit to prostate cancer specifically and other types of men's cancer. Review the importance of support from family and friends, fitting exercise into regular everyday life. And then we'll provide some information. Kristin will talk about some of the local initiatives that are happening across British Columbia. And then I'll talk to you specifically about the Survivor program that we're running across British Columbia and including in the Okanagan this fall and into the new year. Okay, next slide. Okay, so what is exercise? We use this term a lot, but what do we actually mean when we're talking about it? So for our purposes today, exercise is really any planned structured and repetitive and intentional movement performed to improve or maintain one's physical health. So there's lots of benefits to general physical activity, which sometimes we use those terms interchangeably. So physical activity is sort of part of your day-to-day life. It might be walking your dog, going to pick up your groceries, but exercise is a little bit different because it's usually planned and structured, and our goal is really to improve health or fitness. Both have important benefits, but both have sort of distinct benefits when we look at population health. Next slide. So what does exercise do? This is a very long list and very small font, but this is from the most recent US physical activity guidelines that were released in 2018. And so they had an expert panel from around the world that reviewed the evidence on the role of exercise for both adults and older adults. And they found strong, convincing evidence that exercise can lower your risk of all-cause mortality, lower your risk of cardiovascular disease mortality, and cardiovascular disease in and of itself, lowered risk of hypertension, type 2 diabetes, poor blood lipid profile, so high cholesterol, those types of things, lower risks of certain types of cancers, particularly cancers of bladder, breast, colon, endometrial cancer, esophageal cancer, kidney, lung, and stomach cancer. Exercise has a number of benefits as well in improving cognition, reducing risk of dementia, improving one's quality of life, some of the mental health outcomes like reduced anxiety and depression, helping to improve your sleep, slowing or reducing weight gain over time, and can help with weight loss, particularly when it's combined with reduced caloric intake, improve bone health, physical function, and of course, lower risk of falls, particularly in older adults. So lots of really important benefits that we see from exercise. And in terms of our Canadian guidelines, these were released more recently to the Canadian 24-hour movement guidelines. And so our Canadian colleagues talk about a bit more of a sort of comprehensive goals for an overall healthy 24 hours, aside from just exercise, but incorporating physical activity, particularly moderate to vigorous activity. So things that get your heart rate up and might cause you to sweat, at least aiming for 150 minutes per week. Incorporating muscle strengthening activities, moving your body against a weight, so using free weights or machines at least twice a week to improve your strength and coordination, and then physical activities that challenge balance, especially for older adults who are over the age of 65. Incorporating light physical activity. So we talked about the difference between exercise and physical activity. So making sure you're getting some more of that light activity for several hours throughout your day, and that could include standing time. Reducing sedentary behavior, which is on the right-hand side of our screen, something we all should be working towards, limiting our seated time to 8 hours or less each day. So, and breaking up long periods of seated time, which we've all become much more used to as we are in this virtual world, but slowly getting out of it. And then of course, incorporating a healthy amount of sleep. So about 7 to 8 hours of good quality sleep a night. So those are our most recent guidelines from Canada, particularly for those age 65 and older. So we also know that exercise can help with cancer prevention. So I mentioned that in the list from the US physical activity guidelines, but we see when we look across the scientific evidence that's been collected to date, about a 12 to 28% reduction in risk when you meet the recommended levels of physical activity. On the opposite side, though, physical activity can actually increase your risk of melanoma up to 27%, and that's mainly due to people taking part in outdoor activities, most likely not with appropriate sun protection. So we can see here from this infographic that, again, exercise can help to prevent a number of different types of cancer, including the 7 most common types. So colon cancer, stomach cancer, esophageal cancer, bladder cancer, kidney cancer, and then endometrial and breast cancer. But less relevant for our talk this morning on men's health. But we also know that exercise can be really beneficial after a cancer diagnosis as well. It can lower one's risk of cancer-specific mortality, so the risk of dying due to the cancer itself, by about 30 to 33%, and overall all-cause mortality, so death due to any causes, by about 21 to 45%. And this holds true so far from what we see in the evidence for breast cancer, prostate cancer, and colorectal cancer. The one thing we don't know for sure at this point is exactly how much physical activity we need to get to result in that reduction in risk, but we do know that more is probably better than some, and some is better than nothing. And aside from just reducing risk of mortality, exercise can be really beneficial to help manage a number of the side effects of cancer itself, but also the treatment that people go through to treat that cancer. So we know that these treatments have had really important benefits to helping to treat the disease, but can have a number of limiting side effects. Fatigue being the most common one, and probably the most counterintuitive. You think if you're tired and feeling fatigued, that it might be that your kind of instinct is to rest and relax. And certainly that's what used to be recommended to individuals who are experiencing fatigue during treatment. But we know now that exercise is one of the most beneficial things that you can do to help to manage your fatigue during the course and after treatment, starting off slow and building up as you can. Exercise can also help maintain your quality of life, physical function, bone health and sleep, lymphedema for women with breast cancer, and anxiety and depression. So lots of really important benefits aside from just the survival benefit, but just increasing one's feelings of well-being throughout their cancer journey. So this is an infographic from the 2019 physical activity guidelines that were led by Dr. Campbell on the call today through the American College of Sports Medicine. So here are the guidelines for people with cancer. In terms of moving through cancer, the biggest message that we can send is just to avoid inactivity. So trying to move more and sit less, that really has been important benefits for everyone. We know that it can be really challenging to get up and exercise, particularly on those really tough days during treatment. But as much as one can avoid inactivity, that they'll help to already start to maintain some of those health benefits. And then for overall health, aiming to meet those current general physical activity guidelines for adults or older adults in terms of moderate aerobic exercise that we talked about, or vigorous aerobic exercise, plus resistance training twice a week. And then one of the most important contributions to the literature from these cancer exercise guidelines that were released in 2019 were really some more specificity about what is needed to help to reap the benefits of that exercise for different outcomes for people with cancer. So 30 minutes a week, 30 minutes 3 times a week of moderate intensity exercise, and 2 to 3 resistance training exercise sessions of resistance training exercise are really what's most important for just starting to get those main benefits for individuals who are undergoing or have finished cancer treatment. Unfortunately, what we do see from the literature is that most people aren't able to meet these guidelines. So a recent publication from 2017 found that only about 13% of men who had been diagnosed with prostate cancer and 11% of women who'd been diagnosed with breast cancer were actually able to meet those aerobic exercise guidelines. So that's sort of the next step in the process. We know the benefit of exercise, but how can we support people to actually engage in this safely and appropriately during their treatment? So I will now turn it over to Kristin, who'll talk a little bit more specifically about prostate cancer.
Thanks very much, Dr. Neil-Sztramko. So in the light of Movember Beyond the Horizon, as Dr. Bartorov suggested, we're going to focus really about taking that information we have, but what do we know specifically about prostate cancer? So exercise related to heart health, keeping muscles strong, cognition, mood, bone health, as well as overall, this is our levels of vigor and reduced fatigue, our little people up and moving. So in terms of the impact of exercise for men with prostate cancer on energy and mood, there is consistent evidence that regular exercise is more effective at reducing fatigue than any medication. So this was a fantastic review that looked at all the approaches to managing cancer-related fatigue and really showed that exercise was the most beneficial. It did show that supervised exercise was better than home-based. Moderate to vigorous activity intensity was better than mild. And really the combination of aerobic and resistance training that Sarah outlined for us was really the most beneficial. Specifically to men taking androgen deprivation therapy, so a commonly used treatment approach for prostate cancer, resistance training really was most beneficial to helping to maintain, reduce fatigue or maintain energy levels. Higher volumes of exercise was also shown to have lower rates of depression and anxiety when we looked at people who had a prior cancer diagnosis, prostate cancer diagnosis. And what was also seen as structured and group-based exercise was best, had the greatest effect. In terms of urinary incontinence, so due to some of the surgeries and other treatment approaches for prostate cancer, this is a common side effect for some. Pelvic floor exercises done pre-surgery have been shown to improve post-operative continence at 3 months. Meeting the current physical activity guidelines, so as Sarah outlined for us, pre-surgery actually led to improved continence at 6 weeks post-op and less post-operative complications. So at the time of diagnosis, maybe getting people active may be really beneficial prior to some kind of treatment like surgery. In terms of other issues around masculinity, body image, especially with androgen deprivation therapy, there is a change in muscle mass and testosterone levels that people do report as burdensome. And so this is just a quote from a paper that was done by one of our colleagues at the University of Toronto. And the quote here is, regardless of prostate cancer stage, both aerobic and resistance exercise exert a positive effect on feelings of masculinity, body image, and personal identity. And so this was from some qualitative work. The other thing that came up was exercise really helped to reestablish confidence and feeling like you could tackle the activities you wanted to in your day. Specific to ADT, one of the main changes we see is changes in body composition. So an increase in body fat, a decrease in muscle mass, and impact on bone health as well. So you can see the amount of % reduction that happens in the first 6 months to a year after starting androgen deprivation therapy. And the concern with changes in body fat are potentially increasing risks of cardiovascular disease, metabolic syndrome or prediabetes, and also developing type 2 diabetes. The loss in muscle mass really impacts potentially reduced function, as well as potentially independent activities of daily living. So your ability to do the things you want to do during your day. And for bone health, the concern here is increased risk of osteoporosis and some of the side effects related to bone fracture and things that come along with that. So what does exercise do? There's consistent evidence now that resistance and impact exercise. So that means things that have a little bit more of a heavy loading onto the body. That may include things like jumping or using weights to climb stairs, really things that kind of load the bones in a functional way. Helps to attenuate the loss in bone mineral density by about 1 to 3%. Increases the skeletal muscle in your appendicular, which means your arms and your legs, as well as really helps to improve muscle strength. So that addresses some of the key features that we see are lost with ADT. Exercise, specifically the combination of aerobic and resistance, so meeting the guidelines, for example, does help to reduce fat mass and improve overall body composition. So that mix of body fat and muscle mass tries to optimize that. So diet and exercise are commonly recommended to address some of these body composition changes that then impact chronic disease risk factors. Specifically on the heart, because it is one of the main risk factors associated with androgen deprivation therapy, it really is that heart disease is the most common cause of non-cancer death in men with prostate cancer. Androgen deprivation therapy increases these cardiovascular risk factors due to the changes in body fat that I mentioned, potentially increasing risk of being overweight or having obesity or more abdominal fat. Sarcopenia is low muscle mass, so losing a bit of muscle mass and the metabolic changes. Our muscles are very important for helping to regulate glucose in our body, so we can become a little less sensitive to doing that, and that increases the risk of type 2 diabetes, for example. And also, if people aren't feeling a lot of energy, they decrease their physical activity levels, and we know that activity is really important for heart health. So exercise, no surprise, is an effective tool to reducing cardiovascular risk factors and improving heart health in studies where they've measured cholesterol and also heart rates, blood pressures, those type of things in men after prostate cancer diagnosis. Also too, this is data on looking at survival. So after your prostate cancer diagnosis, the way to look at this graph is at the top, you can consider that it says proportional survival of 1.0, pretend that's 100, and at the bottom would be 0. And so what they're showing you is that the people that were most active, the blue dotted line, compared to the least active in the red line, when they looked at years since diagnosis, all the way up to 16 years, those that were more active, the blue line, had a higher percentage of still being alive at that time point compared to the group that was less active. So about 70% of individuals were still alive at that time period, where for the least active group, the mortality risk was a lot higher. So this is observational research. They asked people how active they were over time, and they just followed them over time. So it's not a cause and effect, but it does give a pattern that those that are more active after their diagnosis do seem to have a survival benefit. So greater exercise levels were associated with improved survival. So, I hope at this point you're like, I'm convinced, now what? So at this point, I will hand it back over to Sarah about what we're actually gonna do now that we've convinced you that exercise is what you wanna do.
Kristin, do you wanna speak to some of the local BC resources first, and then I'll take over?
Sure, sorry, I jumped ahead. So, one of the things that came out of the exercise guideline work that was done for individuals after a cancer diagnosis in 2019 were the idea of how to move what we know from research into actual clinical care. So as Sarah mentioned, while we know exercise is beneficial after a cancer diagnosis, not that only 13% of men with prostate cancer were meeting those physical activity guidelines. So there is a gap between what we know in research and what's happening in the real world. So part of the work here was really to see how can we get our healthcare providers to be part of the solution. And this was the acronym Assess, Advise, and Refer. So what we're asking clinicians to do is ask people about their previous exercise over the last 7 days, advise people about the current physical activity guidelines for people during and after a cancer diagnosis, and refer people to outpatient rehabilitation or exercise professionals to support. Now, the big question is refer where? And so what we're hoping to do is to have a one-stop shop website for all the information about programming, whether it's for profit or it is publicly provided, it's research studies, all in one place. So this is a work in progress, but it is our www.cancerexercise.ca. So we're constantly working on this. It's been a work in progress over the summer. So there are tabs where you can see, I'm a cancer patient, I'm a health professional, I'm an exercise professional. If for this particular purpose, you just wanted to find out more information about resources in the community for individuals around exercise, you could go to the I am a cancer patient tab, even if that is not the right diagnosis for you. So here are what some of the local resources are. Specifically for prostate cancer, there is the Prostate Cancer Supportive Care Program. So how to link to that is on the website I just mentioned. There is an exercise support page on BC Cancer that has common questions, resources, more information there. You'll hear more about Survivor BC, which is an exercise program in the community across British Columbia, which Sarah will talk to a bit more. Those that aren't familiar with HealthLink, they don't just have the nurse line, they also have a physical activity service. So you can phone Monday to Friday, 9 to 5, and ask for the physical activity service for cancer. There is one exercise professional at that service who specializes in answering questions for individuals who have had a prior cancer diagnosis. Or if you're just looking for information on how to be more active to decrease your risk of having cancer, not having had it before, that group talks about like what your goals are, what safety concerns you might have, and tries to connect you to things in your own community. And it's a free service. For those that have a prior cancer diagnosis, Inspire Health is a center that provides activity, yoga, other services free of charge. It's funded by the Ministry of Health. And there also are private programs and services across the Lower Mainland. We have listed some of those on our website as well. The exercise support page at BC Cancer, here's just an example of what sort of things you might see there. We have things like exercise can help with certain things, which you've heard about already. And then it has some common questions. So is exercise safe during treatment? I have fatigue, should I wait until I feel better? Some of those kind of questions that are things we commonly have been asked. So we have that information there. So now I'll turn it back over to Sarah.
Great, thank you. So I'll just share a little bit more about the Survivor BC Prostate Cancer Community Exercise Program. So Survivor really came out of a research study that was conducted by Kristin and some other colleagues several years ago at a number of sites across the country called the True North program. And again, it showed, consistent with the other evidence that we've already talked about, that exercise, especially when delivered in the community, can be really safe and beneficial for men during and after prostate cancer treatment. But again, so that we know that when we have some grant funding and we can roll this out in a study, that we can get people in the door and we can have really important benefits. But how do we actually make sure that that continues on and that there are programs that are offered to men living in the community outside of sort of a research setting? So that was sort of the initiation of the Survivor program. So right now in our fall term, we're running sites in North Vancouver, both indoors and outdoors, virtually via Zoom, in Penticton and in the city of Kelowna. And the program is really open to most men who've had a prostate cancer diagnosis. So anyone 19 years of age or older who have been diagnosed at any stage of treatment or recovery. So it's really trying to catch most people who have who are safe to exercise in the community. We do require that all of our participants complete a pre-exercise screening with an exercise physiologist, just to make sure that there aren't any key contraindications that really need to be assessed by a healthcare professional or an exercise professional before moving into the community setting. And we've had some really great success so far with the participants that we've seen who are part of the program. And you'll see a quote here on the right-hand side of the screen from one of our past participants, who said, even though I was going through radiation, which kind of dragged me down, I kept going and I felt good. And that's why I went back, and I'm going to go again. So the men that have taken part in the program so far, we've been doing a bit of an evaluation, which I'll talk to a bit more in a minute, but we've been measuring sort of their physical fitness and improvements in sort of quality of life and those types of things. But we're also doing some qualitative interviews to see, what are the things that really keep them coming back to the program? What things maybe want to change to make it more accessible and more useful for men in the program. And really what we hear is it's that they like to see those health benefits. They like to see themselves getting stronger and feeling like it's easier to get down on the floor and play with their grandkids and go out for walks and do hikes that they used to do prior to their cancer diagnosis. But really, it's kind of that overall feeling of well-being and support that they get as being part of the program, connecting with other men who have gone through similar experiences, and just that really overall feeling of well-being that keeps them coming back to the program time after time. Next slide, please. So here is just a little bit, some photos to show you sort of what it looks like in the Survivor BC program. So these are some images from True North, which was the precursor program to Survivor. So you can see this man here is on the far left-hand side of the screen is doing a squat against the wall with a ball, holding up another weighted exercise ball. So challenging his core, his leg strength, arm strength. The man in the middle is doing, looks like some kind of squat with the ball as well, though you can't see the ball, and progressing to sort of moving to one leg. So all of the exercises in the program are really designed to certainly increase overall strength and fitness, but also are designed to specifically target some of the things that we know are common problems after prostate cancer treatment, especially ADT. So making sure we're balancing, working on balance, preventing falls, working on sort of core common strength areas. So although we know that exercise can be really beneficial to everyone, and particularly men, the exercise program is really designed to sort of target those key areas that we know people have trouble with as a result of their cancer or their cancer treatment. So really the idea behind the Survivor program is to sort of be something that bridges that gap between what we know in research and what's done in practice. So right now we've been fortunate to have some funding from the Prostate Cancer Supportive Care Program to help to roll this out. And so we are doing some evaluation on it now, but hoping that this is something that continues to live on outside of the research grant. So we know that exercise works, but our real question is, how do we deliver this effectively and sustainably in a community-based setting? And so just from an evaluation perspective, as a KT scientist, this is where my interest most lies. How do we understand, what really works and what doesn't work, and how can we set up these types of programs to be successful and sustainable in various communities on an ongoing basis? And so key to that has been our partnership with the BCRPA or BC Recreation and Parks Association, who helped us with rolling these out in community centers rather than just delivering it through a university setting like we have when we're really testing sort of the effectiveness of a program. So we're using something called the Re-AIM framework to look at sort of at a bigger level, how successful is this program? So who are we reaching? We know that when we ask people to sign up for research studies at the university, we get people who live close to the university, we get people who are able to drive there and pay for parking and all of these types of things. So we're getting a really select group of people who take part in our university research studies. But through Survivor BC, we really want to understand how do we reach a broad spectrum of men who may benefit from this program. Of course, we want to know that the program was effective. So when we do deliver something in a research setting, we hire our highly trained staff and we have experts who are delivering the program. But as we roll it out into various communities across the province, we know that there's lots of different resources, lots of variation in sort of who's delivering the program and how it's delivered and what type of equipment is in place. And we've been extra challenged during COVID as we've had to shift to outside versions with no equipment and online versions where people are exercising in their basement and various things like that. So we want to know that the program that we're delivering continues to be useful and effective at all of those important health outcomes as we roll it out sort of into the real world setting. We also want to know that it's adopted appropriately at the community center setting. So through all of the work that led up to this, we've developed the program, but how do you develop the institutional support within the community centers, the rec centers across the province to make sure that it's continued to be offered on an ongoing basis, like some of the other community-based programs that we've all heard about? How do we make sure that it's delivered properly? So making sure that the safety checks are in place so that we know that people who are participating are safe to do so. If there's anyone who needs some of that extra support or screening from a healthcare professional prior to taking part in the program, receives that appropriately. And then maintenance. So how do we make sure that this continues on, as I mentioned, after the grant funding ends from a program perspective, but also how do we make sure that the men who take part in the program continue to exercise beyond the course of what was initially 12 weeks and now sometimes is a 6-week program in different sites. We've learned a lot along the way and have made a lot of modifications. We thought that we were going to roll out into sort of community centers, which all under BCRPA, which all look the same, but we've learned that they all operate very differently and each community has its own resources and challenges. So lots of learning that's gone on throughout the way with Survivor. But for those of you on the line who may be interested or who know someone who might be interested in taking part, we do have several sessions, as I mentioned, running right now and more to come in the new year. So right now we have sessions that are planned to run in the city of Kelowna, in Penticton, in Richmond, city of North Vancouver, and in Saanich on the island. And we're also running a virtual program, and this has been one of the silver linings, I would say, of the pandemic, is that it forced us to switch to a virtual offering, which we were initially very hesitant to do because we know that some of the most important benefits from these exercise programs is that kind of camaraderie and sharing and social support that comes from exercising in person. And as Kristin mentioned in the overview of the evidence, those supervised in-person group-based sessions are most effective, but because of obvious reasons, we had to cancel our in-person programming and have shifted to online. And we've really seen, we've had really, we were happily surprised by some of the benefits that we still do see, and that men were really still able to find those connections even in a virtual environment. And really importantly, we've also been able to reach people who never would have been able to participate in a program. So we have people across northern BC who, in the winter just would not drive to the local community center, where local was a 40-minute drive away. So we've been really able to expand our reach into some of the more rural populations, which has been really great. Or people who just prefer to exercise from the comfort of their own home. They can fit it in. Some of them are still working, so they fit it in on their lunch hour and things like that. So lots of different options there with some registration and contact info that you can feel free to pass on. And then, of course, if you're interested, you can also contact the Survivor Research Coordinator at survivor.bc@ubc.ca or by the phone number that's on the screen. And I will now pass it back over to Kristin to finish off with some new things coming down the pipeline.
Thank you so much, Sarah. So yeah, just to finish up here, obviously, we're all learning, and I think COVID has given us some new opportunities as well, and we realize that we want to reach more people in more places. So Just one example of how things we're planning. This is a group project called Can Rehab. It's in collaboration with our partners at the University of Toronto, and also in New Brunswick and Newfoundland. And so what we're hoping to do is we could maybe ask people who have had a prior cancer diagnosis about some of their side effects and symptoms, and then connect people through this beautiful telephone app here with the programming that might be most beneficial for them. We realize that sometimes rehabilitation and supportive care gets lost a little bit in some of the cancer conversations with the healthcare team. And so allowing people to maybe access that information by filling in a questionnaire, how they're feeling and how they're doing, and having that information kind of pushed to them may help to deal with that gap between what we know in research and what might help in practice. Also too, one of the programs is a virtual-based programming that has a Fitbit, which is in the bottom right here to help you track your activity, and a little bit of a self-guided exercise program that would be delivered by phone as well. So this project is just in the works, and it will probably be launching in January of 2022. And as Sarah mentioned, we also found that virtual exercise works. So when COVID started, we were able to quickly pivot a project we were doing in women who were receiving hormonal therapy for breast cancer. We called it BeFit. And we had signed everyone up for an in-person program. And then I think it was supposed to start, I think they had 2 sessions. It began the first week of March, 2020, which you can imagine timing wasn't great. So we took a pause, readapted everything for a virtual setting, trying to take into account all the things that Sarah mentioned. How do we keep safety high? How do we deliver a good exercise stimulus that we know from a supervised program works well as build in that sharing and social support that people find most beneficial from the in-person programming. So we did strength training 2 days a week with a Zoom instructor. Aerobic exercise was encouraged with a home-based walking program, and there was a lot of education around exercise barriers and things like that. We were really fortunate to get funding from the BC Cancer Foundation for this project. Snapshot, this really encouraged us that this is a viable way to go forward. There were significant improvements in physical function, which is a test we were doing for the 6-minute, some testing we did, quality of life, which was a self-reported measure, as well as improvements in fatigue and energy. We also saw an increase in physical activity exercise levels, even outside the class. The one thing we were also looking at is, does this have a clinical impact as well? And what we saw is that after the program, women were more likely to adhere to their hormonal therapy than they were pre-program. There's a lot of side effects that come with that treatment, bone aches, muscle aches and pains. And so if we can use the program to help people to achieve maintaining the type of treatment that they were prescribed, that is really has a nice lens to try and connect back to our oncology colleagues. These are the things they care about. They want to improve your quality of life and feelings of well-being, but they really want you to get the treatment that they've prescribed as well. So this is our first try it virtual. We've now moved it into the prostate cancer program as well. And we're really excited, as Sarah said, about the increased reach we can have, still maintaining supervised programming to get the benefits of that and still have that social support embedded. So with that, we will stop. We will take any questions you might have about the benefits of exercise related to men's health or cancer, or any other questions you might have.
That was really wonderful. Thank you, Kristin and Sarah, for a really fabulous presentation and new directions for the future, which look very, very exciting. I might start it off. I'm wondering a little bit about the programming for Survivor. Like, you need to start. I'm hearing that it's a closed group. There's a beginning and an end, but I didn't hear how long the program was. And I also wondered how the virtual sessions worked as well.
Yeah, I can take that on. So initially, Survivor was designed as a 12-week program based on, some of the behavior change literature that, we kind of need 12 weeks to make that a bit of a habit. And that's really where, from the evidence, we see that you really start to see those benefits after taking part for 12 weeks. So that was one of the things that was planned in initially. And the program was designed that way, and the initial program was tested that way. One of the things that has evolved a little bit throughout the pandemic is the need for more flexibility at the rec center level. So with the openings and closings and shutdowns and in person and out, when things fall, typically the rec programs prior to COVID would sort of run on this sort of semester schedule. They would typically start in September, sometime run for the 12 weeks, take a few weeks break over Christmas when people go on vacation, when people did that. And then, back in January, again, take a bit of a break early spring. And then sometimes there would be some shifting in programming over the summer, but things sort of typically, the programs in general kind of fit within those 12-week blocks, plus or minus. So it worked out well then. Now with all of these sort of typical timelines being turned on their heads, so one of the rec programs actually asked if they could offer a condensed program or offer only a 6-week program, to sort of fit within what was happening at the center, and also just a bit of trialing out new programs at this point is a big ask. People are just really trying to get the programs that existed previously back to where they were. So we decided to trial it out, and we've had some really great feedback on these 6-week programs, both from the rec centers buying into offering the program, especially for the first time, and also for some of the participants, because a large number of the men that we've had in the program so far are retired or no longer working, or are working, or a lot of them are now working remotely or more of a consulting basis. So they like to go away. And so people are a bit hesitant to commit to those 12 weeks, especially right now when things might be starting to open up. So we just had some qualitative interviews with a rec coordinator yesterday who was saying that the 6-week program, both in Survivor and for other programs, has actually been really, really successful for them. And sort of funnily enough, almost all of the people that had signed up for the first 6 weeks did end up signing up for the second 6-week block as well. So they ended up doing 12 weeks anyways. But there was just something about only committing 6 weeks at a time that seemed to get a bit more buy-in. So that's and it runs twice a week. Virtual as well, we've done that one 12 weeks, I think only exclusively 12 weeks so far with the virtual program. So yeah, it's run by someone who does it. She's an exercise professional who does teach classes out of a center, but also does them on her own, sort of independently from that. So she's run that, and we've had really great success. We initially had some, as I mentioned, some men who just live in areas where they're just not served. They don't have access to a rec center close by, or, driving is a barrier, those types of things, especially in winter in northern British Columbia. We understand why you wouldn't want to commit to that. But we've also had some who had taken part in our in-person programs that were then shut down due to COVID, who then joined the online. And some of them are really, really keen to go back when we offer in-person again. And others are more than happy and they prefer to stay online. So it's been an interesting split. I think it just sort of depends on the individual and sort of their lifestyle and how things fit in. But we've heard from them that, just being able to walk downstairs and they've got their setup and they're ready to go. Others are really keen to get out of the house again, but I think it's just an individual preference.
Right. Yeah, no, that's very helpful. And so do you need a lot of equipment to do the Zoom sessions at home?
I think next to nothing. So that was one of the big modifications that had to happen initially. So the key thing is just having a bit of space and being able to clear out a safe space so that there's no tripping hazards or things like that nearby. But really no equipment's needed. Our instructors have done a really great job at modifying the program. So they'll offer suggestions for increasing the intensity using soup cans or different things that you already find around your house. So no one needs to purchase any equipment to take part. I think some of the men, have bought an exercise mat or something that just makes it a bit more comfortable for them, but certainly you could use a towel. Like there's sort of those things. So no real equipment needed for at-home virtual program.
Great. That's very helpful. Thanks. I see there's a question here from Rebecca. Do you have a family physician oncologist referral form or system in place to increase awareness and intake to these exercise programs? Kristin.
Yeah, I'll happily take that one. So that's a great question. We've done a variety of different things, as you do with these things, to try and get the word out. What we've found to be most effective is connecting with the men themselves through support groups that are happening in British Columbia. We've reached out to, physicians are a little bit hard to pin down. It's hard to kind of connect. And because it is a program that there is a cost, so I don't think we covered that actually, which is probably important information. So with the community-based programming, it's run as a cost recovery model. So the centers all donate the space and any equipment that's used in the in-person program, but the cost is to cover the instructor. And so there are some subsidies that are available through being part of the research study, but it is run on a cost recovery model. So for the first time you register as a participant, it's $50. And after that, it goes up to about $120. So it's quite economical. It's less than $5 a class, but there is that outlay. So when we wanted to connect with, say, the family medicine groups and things across the province, they won't advertise for anything that has a cost associated, which I understand. So we kind of had a bit of a dead end there. The urologists are the main group who might see men with prostate cancer overall. They're a little bit of a challenging group to reach. We have tried. So some of our community centers, the instructor has gone out to urology offices that we saw in the neighborhood and left some flyers. But ultimately, it has been the Prostate Cancer Supportive Care Program, which is run in British Columbia. They have 6 modules, of which exercise is one. They also have sexual health and a few other models. That is the group that probably refers the most men to the exercise programming, as well as just going directly to men. Now, word of mouth is one of our main successful stories too. But ideas are welcome. If there's something, Rebecca, that you think we should do, please put it in the chat and we are happy to hear.
And that's great to hear, Sarah, that some centers have subsidies for those who have financial barriers. So that's great to hear. I guess I'm also wondering, some men might have not really ever joined an exercise class before, or it's been a while since they've been in an exercise class. So I'm wondering how the program encourages them to join or makes it comfortable or okay. And I can imagine that you also have men of various ages and abilities, and so I can imagine that perhaps some older men who haven't been in an exercise class for quite a few years, if ever, might be a bit hesitant to even think that they could do this. Any comments or suggestions are based on the experiences of men who've been in the group?
Yeah, that's I think a really important thing to consider is I think especially our first comers are always the eager beavers who have always exercised, who've done other programs, and they're just looking for something different or more specific. They face additional challenges after their prostate cancer treatment. But over time, I think, as Kristin mentioned, reaching out through the support groups has been really successful in getting some people who have never thought about or joined an exercise class before. They hear it from other men in the group, and they kind of act as our champions and sort of talk about how this isn't like your traditional aerobics class with tight, bright clothes, those kind of things, kind of breaking down some of those stereotypes. So that's been really helpful. But I think it's really, we are constantly trying to think about how to creatively reach some of those people. Posting, we know that just advertising for an exercise program is only going to appeal to people who are interested in exercise programming. So how do we start to broach that? So I think that's where going through the Prostate Cancer Supportive Care Program has helped us too, because most men are going through that. So trying to think creatively there. One of the things that we've gone back and forth with our team as well is whether to keep it exclusively to men who've been diagnosed with prostate cancer or open it up to include friends or include partners. And we've heard mixed opinions on that. We know that there are other programs that include spouses that have been really successful in other areas, but then we've also heard from some of our participants and men who would be eligible for our program that would have actually turned them off of taking part because they really liked having that safe space of only men who have similar experiences to them. So again, this is sort of one of the interesting things about virtuals. We have had a couple of participants whose wives do take part off camera. And so they get their exercise in as well. They're sort of that motivating, driving force as well. But because everyone's virtual and you don't see who's off camera, you don't necessarily have that. I think they were open that their partner was participating, but they're not there visually on the screen, and so they just sort of do it on the side. So there's some people have sort of incorporated that aspect as well. Yeah, it's a constant challenge.
Yeah.
The only thing I would add to that too, to add to what Sarah said, is that the exercise professionals, they have a manual, and so it's there's probably 3 different exercises suggested, or 3 different ways to do a certain exercise to really cater to a variety of presentations, or how easy it is for someone based around their, back pain or knees or things like that. There's a lot in there, and the exercise professionals are really good at doing those adaptations. The guide we have is just, if you wanted to do a squat, here are 3 different ways from the easiest to the hardest, but they also are really good at doing the individual adaptations. So everyone's sort of doing a squat, but everyone might be doing a slightly different version of that, and the instructors kind of cater knowing that.
Yeah, that's great. The other thing is that, recently I worked with a doctoral student on a study about men with prostate cancer, and many of this was about men who actually went back to work after their diagnosis and treatment. And so I'm wondering how the program would fit with men who go back to work, either part-time or full-time. Is the program timed or available at times that they would be able to participate?
Yeah, I can take that one. So I think in our pre-COVID, most of the times that we had were really during like the traditional work hours. And that was for a couple of different reasons. Primarily those times are a little bit set by the rec centers. And so we can sort of suggest times, but they also, obviously, for obvious reasons, have their sort of prime time set aside for their most popular, existing ongoing programs that have a wide reach. So always a little bit of playing around with, what we want to make sure that we offer something for everyone, but there's some limitations in those spaces where you're vying for available rooms. So I think that's been one of the nice things with COVID too, is that, certainly not everyone working from home, but a bit more flexibility for some. And so we have heard from some men that they would never have been able to join the program before when it was offered at noon during the week, but because of, a modified work, their work being remote, they can accommodate that more easily. So I think that's where the virtual program does fit a little bit of a need. Certainly doesn't solve the whole problem, but I would say that I'm trying to think back to all of the sessions that we run, but I'm thinking most, if not all, have been during the day.
And we are
I think there was one where we had the Saturday time, maybe.
Yeah, I think there's a Saturday one that may be coming up soon. And one thing we found with our other virtual program in women with breast cancer, who may be a slightly younger age or more likely to be working potentially, evening classes are a real challenge. Is 5 p.m. evening, so it's after work, but not too close to dinner. 7 p.m. is after dinner. We've really we want to offer a nighttime class, and we had a real hard time figuring out what the right window of time is for that. It's really interesting.
Yeah, I agree. It is very tricky to figure out the right timing. But it was interesting that these men, many of them were going back to work, some of them self-employed, some of them, in jobs that they weren't necessarily office jobs that required them to be fit and able. So I can see an exercise program like this would be very valuable to those men as well, to get back into the work situation, even with the accommodations that they might have to do a transition. Yeah, so something to think about for sure. I'm wondering if there are any questions from our guests, but I don't see any, but I would encourage anyone who's got a question to type it into their chat box. But in the meantime, I might just ask about this CAN Rehab app. So it is really a self-assessment tool and then linking people to programs. It's not the program in itself. Is that right?
Yeah, that's correct. So it's what we recognize is this is particularly during and right after cancer treatment. So connections with the cancer center. Sometimes questions about physical function aren't asked. And so we recognize that potentially, is there a way that we could just prompt people, hey, like it's time to just do a little check-in and ask them those questions that maybe don't get asked at the cancer center. And then it will sort of push out, hey, you've identified, these 3 things. Here are some educational resources. We've also built in that if someone reports like very high levels of distress, for example, that pings then a follow-up from the team, that type of thing. So just a way to realize that physical function and those kind of things aren't asked sometimes, and how do we overcome that and connect people to services that we know would be beneficial if we could access them.
Right. And so are you in the stage of testing that out now, or?
Those beautiful drawings that you saw are the design team. So right now, the design team is working on it, as well as the pathways. So if you insert X, what's the pathway that goes down? So that's the stage it's at now. We've also had focus groups with a patient advisory and stakeholder groups around, what the oncologists want to see, what the nurse practitioners want to see, what patients want to see themselves. So it's being workshopped, but it hasn't rolled out yet. So it hasn't been beta tested.
Okay, all right. Well, we'll certainly look forward to seeing that. And when you need participants, let us know. We can send out the word for people to beta test it and perhaps pre-test it after that. We'd be happy to help out with that. So we're almost at the end of our time. So I do want to thank you very much for sharing this work with us today. It's very exciting to see this research get into practice so that it actually can benefit people living with cancer and being treated with cancer, both men and women, right in our communities and right here in the Okanagan. So that's really fabulous to see. So thank you once again. And I hope that, oh yeah, there is a quick question. How long can they join this program after their treatments? I think you said right away, but.
So yeah, and I think during treatment, after treatment, no time limit really, as long as they pass that screening for some sort of basic safety checks. There aren't, some serious comorbidities that would make it inappropriate for them to start in that community setting. There's no time limit, so it can be, during or many, many years later.
Great, great. So I'm going to tell, do they need an assessment before and after? I think you should say before they need an assessment.
A screening assessment happens before taking part in the program, just for that safety check. Right now, as part of the program, we are doing a bit of an evaluation pre-post, but it happens during the program, so no additional visits to the university or anything like that is needed. But if Rebecca, if you have more questions too, we're happy to continue the conversation offline if there's any more in-depth info that we can provide to you.
And in the meantime, I'll encourage people to look at the website www.cancerexercise.ca, because it has all the information about these programs we talked about, the survivor and etc., as well as other information. So I encourage people, so that's www.cancerexercise.ca. So once again, thank you very, very much. We'll look forward to hearing updates about this research. And hopefully some people in our community might be able to take advantage of these programs that are being offered. So thank you once again. Bye for now.
Thank you.
Thanks everyone for joining us. Bye.